Okay. If you watch the video on dermal puncture, you see that you can fill the capillary tubes directly from a finger stick. But what we're going to do for this microhematocrit is we are going to fill it from a previously drawn tube of blood. So we're going to start with a properly filled, properly labeled, unclotted tube of EDTA blood. As with all hematology, we're going to mix it before we use it. You always want to make sure that you thoroughly mix a hematology tube. You can fill the capillary tubes one at a time. We're going to fill it 2/3 to 3/4 full. If you just stick it in there and kind of tilt the tube of blood a little bit, it will just run right up. Then what you want to do is tilt it just a little bit so that it runs just a little bit of air at the end here. Then put your finger over it and gently press the clean end into the clay. You want to be careful not to squeeze it or push too hard because the capillary tube can break and it will cut through a glove. Because we've had some trouble with the clay sealing, we actually do double seal our hematocrit tubes just to be on the safe side. Then you would take your second tube, fill it to approximately the same level as the first tube. Again, just let it roll down a little bit so that when you put the crit seal in, the blood doesn't squirt out the end. We can't actually label the capillary tubes because they're too small, so the way we keep track of patient ID is by noting what is in what position. The other thing you can do is actually fill 2 of them at the same time. Again, we're just going to mix the blood again a little bit. Some people's blood settles very quickly. And all you do to do that is take both tubes and let the blood fill. If one's filling faster than the other, you can just kind of put your finger on the end. Then once they're full, again, just let the blood run down a little bit so it's not all the way at the end. Put your finger over the dirty end and seal the clean end. Again, do be careful so that you don't break one and have it go through your glove and puncture your skin.